Is nifedipine safe while breastfeeding? Have you ever wondered if taking medication while breastfeeding is safe for your baby? Today, we are focusing on nifedipine, a medication often used for managing high blood pressure. Let's take a closer look at its safety during breastfeeding. Nifedipine is a calcium channel blocker that helps lower blood pressure. When mothers take this medication, it does pass into breast milk, but the amounts are very small. Research shows that the concentration in breast milk is usually between 1.6% and 3.4% of the dose the mother takes. This is much lower than the doses that would be given to infants. So, what does this mean for breastfeeding mothers? Generally, the risk to the baby is minimal. In fact, there have been no reported adverse effects in infants who have been breastfed by mothers taking nifedipine. However, it is always wise to keep an eye on your baby for any unusual signs. Some signs to watch for include drowsiness, lethargy, pale appearance, poor feeding, and inadequate weight gain. These symptoms are rare, but if you notice any of them, it is important to consult a healthcare provider. Interestingly, not every mother metabolizes nifedipine the same way. Some women may process the drug differently due to genetic factors. For example, a genetic variation known as ABC 2 degrees Celsius to 1 degrees Celsius A can lead to higher levels of nifedipine in breast milk. Even in these cases, the amounts are still generally not harmful to infants. Now, let's connect this to hypertension management in pregnant women. Managing high blood pressure during pregnancy is vital to avoid complications like preeclampsia. Nifedipine is sometimes prescribed to help control blood pressure in pregnant women. While it is usually safe during pregnancy, careful monitoring is essential for both the mother and the baby. For women who need to continue managing hypertension after giving birth, knowing the safety of nifedipine while breastfeeding is important. The overall safety profile of nifedipine suggests that it can be a helpful option for controlling blood pressure in breastfeeding mothers. In summary, nifedipine is considered safe for breastfeeding due to its minimal presence in breast milk and the lack of reported side effects in infants. However, monitoring for any potential side effects is always a good practice. If you are a breastfeeding mother and need to manage hypertension, nifedipine could be a suitable choice, as long as you take the necessary precautions.